Generalized anxiety disorder. An anxiety disorder in which a person is continually tense, apprehensive, and in a state of autonomic nervous system arousal. Phobical disorder. An anxiety disorder marked by a persistent, irrational fear of a specific object or situation. Panical disorder. An anxiety disorder marked by a minutes-long episode of intense dread in which a person experiences terror and accompanying chest pain, choking, or other frightening sensations. Obsessive-compulsive disorder. An anxiety disorder characterized by unwanted repetitive thoughts and or actions. Hypochondriasis. A somatoform disorder in which a person interprets normal physical sensations as symptoms of a disease. Multiple personality disorder. A rare dissociative disorder in which a person exhibits two or more distinct and alternating personalities. Mood disorders. Psychological disorders characterized by emotional extremes, see bipolar disorder, major depressive disorder, and mania. A mood disorder in which a person, for no apparent reason, experiences 3 or more weeks of depressed moods, feelings of worthlessness, and diminished interest or pleasure in most activities. Bipolar disorder. A mood disorder in which the person alternates between the hopelessness and lethargy of depression and the overexcited state of mania. Schizophrenia. A group of severe psychotic disorders characterized by disorganized and deluded thinking, disturbed perceptions, and inappropriate emotions and actions. Personality disorders. Psychological disorders characterized by inflexible and enduring behavior patterns that impair social functioning. Q1. List the criteria for judging whether or not behavior is disorganized. Impaired attention, disturbed perceptions, inappropriate emotions and actions, disorganized thinking. Q2. Describe system used to classify psychological disorders and explain the reason for its development. The current authoritative scheme for classifying psychological disorders in the American Psychiatric Association's DSM-IV. The DSM describes disorders and their prevalence without presuming to explain their causes. It is used to describe a disorder, to predict its future course, and to imply appropriate treatment. Q3. Describe 3 anxiety disorders and their causes. Generalized anxiety disorder equals those who suffer a generalized anxiety disorder may for no clear reason feel uncontrollably tense and uneasy, an anxiety that can turn into a panic attack. Phobic disorder equals those with phobical disorder may be irrationally afraid of a specific object or situation. Obsessive-compulsive disorder equals persistent and repetitive thoughts and actions characterize the obsessive-compulsive disorder. Q4. Describe two somatoform disorders. Conversion disorder. A patient with a conversion disorder might lose sensation in a way that makes no neurological sense, yet the physical symptoms would be real. Hypochondriasis equals people would interpret normal sensations as symptoms of a dreaded disease. Q5. Describe two dissociative disorders. Fugue equals like amnesia, dissociative disorder in which flight from one's home involves presumed forgetting, but also involves fleeing one's home and identity for days, months, or years. Multiple personality disorder equals people would have two or more distinct personalities. Q6. Describe two mood disorders. Bipolar disorder equals person alternates between the hopelessness of depression and the hyperactive phase of mania. Major depressive disorder equals the person, without a reason, for weeks or months go into a deep unhappiness and feelings of worthlessness before rebounding to normality. Q7. Describe schizophrenia and include symptoms and list two types. Schizophrenia equals psychotic disorder in which a person loses contact with reality, experiencing grossly irrational ideas or distorted perceptions. Symptoms: disorganized thinking, disturbed perceptions, inappropriate emotions and actions. Examples: schizophrenia with positive symptoms and schizophrenia with negative symptoms. Q8. Describe personality disorders and specific characteristics of antisocial personality disorder. Personality disorders, enduring maladaptive patterns of behavior that impair social functioning. Antisocial personality disorder, a personality disorder in which a person shows a lack of care for wrongdoing, even toward friends and family members, may be aggressive and ruthless or a clever con artist. Abnormal behavior. Behavior characterized as atypical, socially unacceptable, distressing to the individual or others, maladaptive and/or the result of distorted cognitions. Model. An analogy or a perspective that uses a structure from one field to help scientists describe data in another field. Abnormal psychology. The field of psychology concerned with the assessment, treatment, and prevention of maladaptive behavior. Prevalence. The percentage of a population displaying a disorder during any specified period. Case study. A descriptive study that includes an intensive study of one person and allows an intensive examination of a single case, usually chosen for its interesting or unique characteristics. Anxiety. A generalized feeling of fear and apprehension that may be related to a particular situation or object and is often accompanied by increased physiological arousal. Phobical disorders. Anxiety disorders characterized by excessive and irrational fear of, and consequent attempted avoidance of, specific objects or situations. Agoraphobia. Anxiety disorder characterized by marked fear and avoidance of being alone in a place from which escape might be difficult or embarrassing. Panic attack. Anxiety disorders characterized as acute anxiety, accompanied by sharp increases in autonomic nervous system arousal, that is not triggered by a specific event. Social phobia. Anxiety disorder characterized by fear of, and desire to avoid, situations in which the person might be exposed to scrutiny by others and might behave in an embarrassing or humiliating way. Specific phobia. Anxiety disorder characterized by irrational and persistent fear of a particular object or situation, along with a compelling desire to avoid it. Obsessive-compulsive disorder. Anxiety disorder characterized by persistent and uncontrollable thoughts and irrational beliefs that cause the performance of compulsive rituals that interfere with daily life. Depressive disorders. General category of mood disorders in which people show extreme and persistent sadness, despair, and loss of interest in life's usual activities. Delusions. False beliefs that are inconsistent with reality but are held in spite of evidence that disproves them. Learned helplessness. The behavior of giving up or not responding, exhibited by people and animals exposed to negative consequences or punishment over which they feel they have no control. Vulnerability. A person's diminished ability to deal with demanding life events. Dissociative disorders. Psychological disorders characterized by a sudden but temporary alteration in consciousness, identity, sensorimotor behavior, or memory. Dissociative amnesia. Dissociative disorder characterized by the sudden and extensive inability to recall important personal information, usually of a traumatic or stressful nature. Dissociative identity disorder. Dissociative disorder characterized by the existence within an individual of two or more distinct personalities, each of which is dominant at different times and directs the individual's behavior or at those times, commonly known as multiple personality disorder. Schizophrenical disorders. a group of psychological disorders characterized by a lack of reality testing and by deterioration of social and intellectual functioning and personality beginning before age 45 and lasting at least 6 months. Psychotic. Suffering from a gross impairment in reality testing that interferes with the ability to meet the ordinary demands of life. Paranoid type of schizophrenia. Type of schizophrenia characterized by hallucinations and delusions of persecution or grandeur, and sometimes irrational jealousy. Catatonic type of schizophrenia. Type of schizophrenia characterized either by displays of excited or violent motor activity or by stupor. Disorganized type of schizophrenia. Type of schizophrenia characterized by severely disturbed thought processes, frequent incoherence, disorganized behavior, and inappropriate affect. Residual type of schizophrenia. A schizophrenical disorder in which the person exhibits inappropriate affect, illogical thinking, and/or eccentric behavior but seems generally in touch with reality. Undifferentiated type of schizophrenia. A schizophrenical disorder that is characterized by a mixture of symptoms and does not meet the diagnostic criteria of any one type. Concordance rate. The degree to which a condition or traits shared two or more individuals or groups. Double bind. A situation in which an individual is given two different and inconsistent messages. Antisocial personality disorder. Personality disorder characterized by egocentricity and behavior that is irresponsible and that violates the rights of other people, a lack of guilt feelings, and inability to understand other people, and a lack of fear of punishment. Child abuse. Physical, emotional, or sexual mistreatment of a child. Rape. Forcible sexual assault on an unwilling partner. Counseling psychologists specialize in the diagnosis and treatment of psychological disorders and everyday behavioral problems. Psychiatrists. Physicians who specialize in the diagnosis and treatment of psychological disorders. Insight therapies. Verbal interactions intended to enhance clients' self-knowledge and thus promote healthful changes in personality and behavior. Psychoanalysis. An insight therapy that emphasizes the recovery of unconscious conflicts, motives, and defenses through techniques such as free association and transference. Free association. Clients spontaneously express their thoughts and feelings exactly as they occur, with as little censorship as possible. Dream analysis. Therapist interprets the symbolic meanings of the client's dreams. Interpretation. Therapist's attempts to explain the inner significance of the client's thoughts, feelings, memories, and behaviors. Resistance. Largely unconscious defensive maneuvers intended to hinder the progress of therapy. Transference. Occurs when clients unconsciously start relating to their therapist in ways that mimic critical relationships in their lives. Client-centered therapy. An insight therapy that emphasizes providing a supportive emotional climate for clients, who play a major role in determining the pace and direction of their therapy. Group therapy. The simultaneous treatment of several clients in a group. Spontaneous remission. A recovery from a disorder that occurs without formal treatment. Behavior therapies. The application of learning principles to direct efforts to change clients' maladaptive behaviors. Systematic desensitization. A behavior therapy used to reduce phobic clients' anxiety responses through counter-conditioning. Aversion therapy. A behavior therapy in which an aversive stimulus is paired with a stimulus that elicits an undesirable response. Social skills training. A behavior therapy designed to improve interpersonal skills that emphasizes modeling, behavioral rehearsal, and shaping. Biofeedback. A bodily function is monitored, and information about the function is fed back to the person to facilitate improved control of the physiological process. Biomedical therapies. Physiological interventions intended to reduce symptoms associated with psychological disorders. Psychopharmacotherapy. The treatment of mental disorders with medication. Anti-anxiety drugs. Relieve tension, apprehension, and nervousness. Antipsychotic drugs. Used to gradually reduce psychotic symptoms, including hyperactivity, mental confusion, hallucination, and delusions. Tardive dyskinesia. A neurological disorder marked by involuntary writhing and tic-like movements of the mouth, tongue, face, hands, or feet. Antidepressant drugs. Lithium. A chemical used to control mood swings in patients with bipolar mood disorders. Electroconvulsive therapy. A biomedical treatment in which electric shock is used to produce a cortical seizure accompanied by convulsions. Eclecticism. The practice of therapy that involves drawing ideas from two or more systems of therapy instead of committing to just one system. Mental hospital. A medical institution specializing in providing inpatient care for psychological disorders. Deinstitutionalization. Transferring the treatment of mental illness from inpatient institutions to community-based facilities that emphasize outpatient care. Placebo effects occur when people's expectations lead them to experience some change even though they receive the fake treatment. Regression toward the mean occurs when people who score extremely high or low on some trait are measured a second time and their new scores fall closer to the mean.